Mental health disorders can be a touchy subject when it comes to cannabis therapy. Today, we're going to talk about autism and ASD and how cannabis can and might not help. Welcome back to Discover Marijuana. I'm here with Josh Fitzgerald, a cannabis pharmacist at Deseret Wellness here in Provo. And today, Josh, we're talking about the autism and the autism spectrum disorders and cannabis use for those. This is a really complicated issue, and I think it's very, very personal for different patients. But what do we know about autism and cannabis?
Cannabis can really help calm the mind down. And when we're talking about autism, we're talking about racing thoughts and not an ability to kind of control your thoughts and actions. And so cannabis definitely helps kind of tone the body down and tone the mind down a little bit. And that's what we kind of use it for in this situation.
In this situation, so it's not necessarily like, when I think about other mental health disorders or other stimulants that we use, like Adderall or Ritalin, not necessarily that we're using those for autism, but when we compare those to cannabis, there's some cannabis strains or products that are stimulating and some that are sedating. Do you find that with autism, you're usually just lowering that activity and trying to use sedating properties?
Yes, and then we're trying to break some of the cyclic properties of autism where they'll get just hyper-focused on something and keep going over and over and over again. When you can add a stimulus and like low-dose THC to that, it breaks that cycle and kind of helps calm the brain down at that point. And then combining THC and CBD together really affects it on both ends. So you're getting more of the calming effect and breaking that cycle and the thought process that's going on there.
Do you recommend certain delivery methods to be better for these types of conditions?
Yeah, so when we talk about autism, mainly what we see here in my pharmacy is children. We don't see a lot of adult autism usage. So we're talking about children that can't dose themselves properly, and they're just not able to do that, nor do they have an understanding of what's going on, really. So we want to look at dosage forms that are easy to use, mainly like tinctures. We can use low-dose edibles also to help. And then we also got a new form of patch out that has Delta-8 and Delta-9 in it. We've talked about those in other videos that can kind of help just keep the thought process to a minimum and calm the body down itself. It's great in patients that have autism because you can put it on an area of their skin where they can't reach. And sometimes our autistic kids kind of pick at patches, but if you can put it on their back in a certain area where they can't reach, that way they can keep the patch there and keep medicated.
What's the dose of that patch?
It comes in different dosage forms. It usually starts around, there's some in 5 milligram, they go all the way up to about 25 milligrams. And so we're going to start really low when they first come in and see how that works. The patches last about 10 to 12 hours, depending on the person. It's a systemic effect, so they're going to feel it throughout their whole body. And we can really dial in the dose that way with it.
That's fascinating and really a good way to get a consistent dose all the way through. We've talked a little bit about transdermal patches, but not a lot. And there's not a lot of products out there. There would be only one product here in Utah that's like that. Who makes it?
Standard Wellness does.
Oh, cool.
Yeah. And so we do a lot with them, and we're able to get some of their products in here.
So it's really tincture dosing with those drops.
Yes.
And
patches and maybe edibles if they're able to do that.
If they're able to do that. Really low doses. We're talking 5 milligrams
even
THC,
less sometimes.
Or even less of that is just enough. I know with patients that we've treated, we're just giving a few drops in the morning and a few drops, maybe 2 milligrams of THC, really that microdosing.
Yep.
So when it comes to that dosing regimen, are you recommending that we do a consistent across the day, or are we increasing and decreasing the dose depending on behavior? Depending
on behavior, really. But if you can keep a low dose type of THC in their system at all times, it kind of prevents some of those acting out or behavioral issues. So like I said, the patches work great. But then, using the drops and the tinctures on top of that in specific times of need, that's a good benefit for the patient.
So one last thing, we haven't talked about any inhaled methods for this autism type disorder.
Yeah.
I would imagine that, from my experience treating kids, we're definitely not using any inhaled methods.
We're not, yeah.
For adults, are there any strains or temperature ranges that you find that are beneficial, or is it really just...
Temperature ranges, definitely, you can get some benefit in the lower ranges where you're going to get more of a cannabinoid profile. So I wouldn't go past like 375. You're going to get more of the cannabinoids rather than a lot of THC.
Mhm.
So yeah, if they're going to be using flower, definitely stay in that 300 to 375-ish range. But really,
Cool.
changing the temperature to find what works best. When we're looking at other inhalation forms, like vaporization methods, I couldn't say a specific strain, but knowing what to use and when to use it. So using a sativa during the day if they need it, or mainly using hybrids just because it has more of a calming and relaxing feeling to it, and then indicas for night. So yeah,
Cool.
just the basics kind of with it.
So really some tips and tricks for autism use disorder and especially kids with autism, keeping a very low dose of THC on board almost at all times seems to be very helpful. Using tinctures is probably the better method for that breakthrough behavior
is.
because they're going to be faster acting than the patch.
Yep.
But staying away from inhaled methods pretty much for anybody under 21 is probably recommended.
Exactly.
As far as from a safety profile. Make sure that you're talking to your qualified medical provider, your licensed medical provider, your pharmacist when it comes to dosing and delivery with anything, especially with kids. With adults with autism, keeping a journal of what is working and being able to go back to that journal is going to be really helpful. Thanks for watching. Be sure to subscribe. We're going to do another video on IBS, anxiety, and be sure to comment below if you have experience with autism and you have a question regarding like what strain to use or you have found something that is working for you.